Hi, I'm Dr. Anna Martinez, and this is my nurse Cindy, and we're here today to talk about some commonly asked questions that we see every day about vaginal discharge.
And some of those questions are like, how much vaginal discharge is normal?
Well, there's always, all women have a small amount of physiologic vaginal discharge that changes at various points during the cycle. It's usually notable but not an excessive amount where it's staining your clothes or having an excessive odor or a consistency that's very thick. Or
Okay, so how come it varies like on different days?
Well, your cycle, there's different hormones that come into play with your cycle. For example, during ovulation, the mid part of your cycle you tend to have a lot more discharge, you have a lot more cervical mucus and things like that. So you may notice at different times in the cycle because of the hormonal changes that you're getting more discharge at some points and less at others.
Okay, so kind of back to the first question, I mean, what should it actually look like?
Generally, it can be a clear mucousy type discharge. It can be sort of a white to maybe a pale yellow. And that's usually what a normal discharge would look like.
Okay, and then around ovulation, that's different, right?
It can be, yes. It tends to be more mucousy, large amounts,
okay.
And people notice that definitely.
Okay. I mean, should it have a definite odor to it?
Really not an obvious odor. It's kind of it's a normal way of the vagina to cleanse itself, and so there is a sort of a natural mild odor, but nothing that's excessive that seems to be very strong, particularly.
So, like, when should I be concerned? What would make me want to see a doctor for vaginal discharge?
Something where you feel that it's so much more coming out, if you're having to wear a pad, if you feel like it's staining your clothing, sometimes an odor that really that doesn't go away after washing, that sometimes a little bit of more of a fishy odor versus kind of the normal vaginal smell. Abnormal colors, for example, if it's a dark green or a really dark yellow or maybe a dark brown or something like that, something that changes when the colors are really changing, that's something where we need to really contact your doctor.
Thank you.